Let's face it, childbirth changes our bodies. And while it's normal for our bellies to be stretched and maybe a little saggy after giving birth, if you continue to look pregnant many months after giving birth, you could have a condition called diastasis recti. In this video, I'll cover how to tell if you have diastasis recti and what you can do about it. Hi, I'm Genevieve Holland, the mama behind MamaNatural.com and the author of the best-selling book, The Mama Natural Week by Week Guide to Pregnancy and Childbirth. If you've recently had a baby, be sure to sign up for my free baby series over at MamaNatural.com/updates. And each week I will send you valuable tips and tricks to help you and baby thrive. Also, check out my new baby care course at MamaNaturalBaby.com. It's taught by me and a holistic pediatrician and an IBCLC lactation consultant. Head over to MamaNaturalBaby.com for more details. Okay, so let's start by defining exactly what is diastasis recti, also known as abdominal separation. Diastasis recti is defined as having a gap of roughly 2.7 centimeters between the rectus abdominis muscles. Now, in less technical terms, it means that your belly sticks out because the space between your right and your left abdominal muscles, which normally holds in some of your body's infrastructure, has now widened, letting the uterus and your bowels move forward and almost pooch out. Now, the severity of the condition depends on how large that gap is. The wider the gap, the more severe your condition. So how do you know if you have this? Well, it actually can be pretty easy. You probably suspect it if you have just this loose pooch belly that, but doesn't really make sense in your body because maybe the rest of you is pretty slender and you're like, what is this? And some moms just have kind of an intuitive sense. They feel weakness in their abs. Well, let me tell you, there's a really easy at-home test that you can do to see if you have diastasis recti. First, you want to lie on your back with your knees bent and your feet flat on the floor. Then you want to slowly lift up your head as if you're doing a crunch, and you want to start by pressing 2 fingers into the flesh around your belly button. You will feel the walls of your abdominal muscles actually squeeze your fingers as your muscles contract. Now, the more fingers that you can fit in that gap, the worse your condition is. Now, obviously, this is kind of a crude way to test, but it is pretty accurate, but you always can get a second opinion with a qualified physical therapist or a doctor who really understands diastasis recti. So now let's talk about what can you do if you have this condition. Well, we need to basically bring those abdominal walls back together again, and in most cases, this can be done with very specific pelvic floor and core exercises. So that's a good news, no surgery or anything like that. But it is so critical that you do the right type of ab and core workouts because there are some exercises like crunches or planks that if they're not done correctly, they can actually make your condition worse. So it's super important to work with a physical therapist who really understands this condition. They can come up with a customized program for you. Now, having said that, some moms can't afford to see a physical therapist, or some moms just want to get started like yesterday. I'm just doing simple things to help this separation. I'm going to share with you a couple exercises that are generally safe for women that have diastasis recti. Now, the first one is basically doing a bridge. A bridge helps to strengthen your hips and your glutes and supports your overall core. So to do this, you want to lie face up with your knees bent about hip width apart. Next, you're going to contract your abs or engage them. So a good way to think about this is like you're trying to push your belly button to the back of the floor. And then what you want to do is press down through your heels and lift your hips up toward the ceiling. Now, to supercharge this exercise, you can put a yoga brick or a ball in between your thighs. Now try to squeeze that ball while you're still in the bridge position and your abs are still engaged. Here's another exercise you can try. They're called toe taps. So toe taps help us learn to use our core to lift our legs and not just our quads. So to do these toe taps, again, you want to lie on your back and you're going to lift your legs up so that your knees are bent in a 90-degree angle. So your legs should look like little tabletops. Then you want to take your right foot and tap those toes onto the floor. Then you'll resume back to that 90-degree position, and then you'll take your left foot and just tap those toes on the floor. And then you'll just go back and forth and back and forth. You also can try heel slides. Again, you'll lie on your back with your legs bent, feet flat on the floor. And what you want to do is slowly straighten out one leg forward on the mat. And you want to keep it hovering above the floor. Then slowly pull your leg back into the bent position and repeat this back and forth for about 10 counts. Now, if you're a visual learner or you kind of need an instructor to be going through these exercises with you live, there are several at-home programs that are fantastic. If your doctor gives you the approval, I recommend the pelvic floor piston. This is taught by a physical therapist named Julie Wiebe. Katie Bowman also has an excellent book called Diastasis Recti, this whole body solution to abdominal weakness and separation. And if you like virtual workouts, you can try Fit2Be Studio. What I really like about their workouts is that they have them specially labeled for safe tummy exercises. So you know, okay, this workout's gonna be safe for me if I have diastasis recti. I'll have links to all these resources in the video description below. So there you have it, mama, how to deal with diastasis recti. Thanks so much for watching. Be sure to subscribe to my channel for more natural parenting videos, and to take a deep dive into natural baby care, head on over to mamanaturalbaby.com to check out my new class, taught by me and a holistic pediatrician and an IBCLC lactation consultant. It's really the best way to learn how to parent with calm and confidence. Finally, sign up for my free Baby's First Year updates. Go to mamanatural.com/updates. I'll be sending you parenting tips and tricks that are tailored to your baby's age and developmental stage. Thanks so much for watching. We'll catch you next time.